We had a young girl. She was like about 15 years old, and she came with her mother, and she was quite distraught. She's a really nice girl, like a swimmer, hyperlax. So basically her ligaments were quite stretchy. And she came in saying that she'd had 7 or 8 elbow dislocations. And to be honest with you, that's not a very common diagnosis that we see. And you want to obviously check to make sure that's the real thing. And even in the office, we could provoke her to dislocate her elbow. And she really couldn't do any sports. She couldn't do anything else. Her mom was begging us to see if there's any options for her. She had seen multiple opinions and really no help. And the problem is, when someone actually is dislocating their elbow, they put their cartilage at a much higher risk. But also, this patient had a lot of stretchy joints, we call it, or hyperlax joints. And so you had to be really careful with her, because the biggest thing here is especially with elbows, and Dr. Weil takes care of a lot of elbow contractures and stiff elbows, to understand is that it's great. You don't want to have someone with a loose elbow, but you really, really don't want to have someone with a stiff elbow. And so that took a lot of planning from both of our parts, and pretty decent sized surgery to get her better. But we did a ligament reconstruction and a ligament repair on one side, and we used some innovative techniques and some things that, again, bringing up the point, there were certain things that I felt comfortable with, and there were some things that Dr. Weil had done more of these previously, because he, treats a lot of elbow fractures and elbow dislocations. So for him, he sees more of them than I do in terms of the actual elbow dislocation. And we were able to protect the nerves during that case. And it was a pretty impressive result. She went back to doing push-ups, swimming, etc. And we've both seen the family members back as well who have the similar conditions, not the same elbow, but other conditions in their body. And it's been sort of a recurrent thing for the family to be taking care of them.
You